Good afternoon and welcome you again. I'm Lucinda Bryden, Director of Alumni Relations. On behalf of the SUNY Delhi Alumni Association, it's my real pleasure to introduce Dr. Susan Deane. She's both Professor and Dean of our School of Nursing here at the college. She's got an impressive background both through education and experience. Susan began her higher education journey by earning her registered nursing degree from St. Francis School of Nursing. She then went on to get her bachelor's of nursing at St. Joseph College. Susan also holds a postmaster's certificate from Drexel University, a master's degree in nursing education from Hartford University, and she also obtained a research and professional doctoral degree focusing on educational leadership from North Central University in San Diego. Truly, the field of nursing has greatly benefited from Susan's dedication through the decades, and SUNY Delhi has been most fortunate to have her service for more than 10 years in various positions, and most recently as our interim provost. Without further delay, I'd like to turn the webinar over to Dr. Deane and ask her to introduce our wonderful panel joining us this afternoon. Thank you and enjoy.
Thanks, Lucinda, for that wonderful introduction. And now I really want to introduce our panelists because we are very fortunate to have you all here today for this webinar. And I am going to start with Kyle Merandy, who is a alumni of class of 2001, I believe. He's a nurse practitioner at New York Presbyterian, the Weill Cornell Medical Center, where he has practiced for the last 15 years. With a specialty of cardiothoracic surgery and inpatient urology. So welcome, Kyle.
Thank you. Thanks for having me.
Thank you. Julie Hall, you are actually a dual alumni, having graduated from our ADN and our BSN program, most recently in 2012 from the BSN program. And Julie is the Director of Acute Care Nursing at Bassett Medical Center and a care coordinator as well there. So thank you for joining us today as well.
Thank you.
And Emily Mattison, she is a 2016 alumni and worked right after graduation at Bassett on a medical unit, and in 2018 kind of transferred over to the ICU area, in which she has her expertise in continual renal replacement therapy, and as a post or past dialysis nurse, kudos, and also post-op open heart experience. And Whitney Hyde is a graduate of our MSN program in nursing education, and I believe in 2019. Thank you. And is currently working in an outpatient neurology area in upstate and is a clinical training specialist. And last but not least is our Christopher Samson, who is in our current MS in Nursing Administration program, and he will be graduating in next year in 2021. He has worked in behavioral health for several years and then switched over to emergency nursing, going from staff to charge nurse, and that's why he's pursuing his degree in nursing education. So that is our panelists, and thank you for taking the time to be with us today. So my first question, or first kind of conversation that I think we need to have is just kind of some general reflections or lessons that you kind of can share with our audience about working through or working during this pandemic. Now that we've kind of maybe had a little bit of a lull, and can kind of reflect on, what happened during that time and what can you share with the audience. And Kyle, I'm going to start with you as being our most seasoned alumni.
Yeah, thank you. So some of my reflections, as I think you mentioned, everyone, I'm down here in New York City, and we really got clobbered pretty good. And, I compare it to what we faced down here to almost like a battle. It was kind of like a war that we had to fight as nurses. None of us ever anticipated this kind of thing happening, but it nonetheless happened. And so we rallied, you know, like troops would rally for a battle, and did the best we could in the circumstances we had. You know, it was, I feel like we overall won that battle, but it was scary. It was, you know, we saw a lot of things that we weren't used to seeing, and it's practicing as long as I had. I felt like a new nurse again, you know, because of all the stuff we didn't know about this disease, this illness. And then, you know, to compound everything for me, I got COVID, you know, I got really sick, and I watched my life flash in front of my eyes, you know, and that was a scary experience for me. And in management, so I mix management and urology. The CT cardiothoracic surgery part is management. So I manage 38 nurse practitioners. So I was home sick. That didn't stop the pandemic. So I had to help them know what to do. And so I was essentially working sick from home, you know, dealing with this. And it was quite an experience. But overall, I had to help get our nurse practitioners redeployed to, you know, we have a lot of sister institutions. Some got hit harder than others, you know, and so I had to help redeploy my staff. So it was quite an experience, you know, overall. But like I said, I liken it to a battle. I feel like we did win, and I was so proud of all the nurse practitioners and nurses, because they really stepped up to the challenge. And I said to some of them, I don't know, me being out sick and stuff, managing from home, I don't know if I would have done as well as you guys did. So I was really proud of the team I was with, just seeing, you know, to go, you know, whether you're a nurse practitioner, to go from where you're comfortable working to another hospital even, you know, is really, that's a real stressor, you know. And so I don't know if that kind of is a adequate reflection, but it was quite the experience.
I mean, and I'm going to ask the others as well, but I think one of the things that strikes me, Kyle, is that you did say that we had never seen this. I mean, I've been a nurse for over 40 years, and again, there was no guidelines. You know, there's no procedures written for this, but I do feel that you know, that's part of our instinct, that's part of our training, that's part of our experiences that in some way prepares us for those kind of things, though this was obviously very unprecedented. And Julie, I know you're shaking your head, so I'm going to call on you next about your reflections, you know, because again, of the acute care that you were providing at the time, or your nursing staff. So please.
Kyle, I'm glad you're okay.
Thank you.
And, you know, I can tell you, as this wave started to kind of roll across the state, you know, I have colleagues down in the city as well, and to hear them sending me messages about what we were anticipating, right? Because you guys were living in it, and it was starting to slowly creep up here, and the stories just petrified me, right? So as a person who was in charge of the entire acute care nursing division, including critical care at that time, I thought, oh my God, how, thankfully, thank you to you, everybody downstate, we had a little bit of warning, and we had a little bit of preparation. So as volumes were decreasing in the hospital, because people were petrified to come out to the doctor or to go to the ED, we noticed that we had staff that we did not need because the hospital was emptying out. And so, you know, when you look at a fiscal kind of perspective of running a hospital, the uppers were saying, Julie, you have to call people off. You have to send them home. And I said, okay, time out. We have such an opportunity right now to cross-train. So what we did was we pulled clinic nurses into the acute care setting to work med-surg that they hadn't done in years. We pulled the med-surg nurses up to the special care unit to do progressive care and cross-train them there. And we pulled the special care units into the intensive care unit to kind of beef up our intensive care, knowing what was coming. And what we did was we took our whole 5th floor, which is progressive care and intensive care, and kind of created one big intensive care unit. And we followed suit in some of the best practices that you all did downstate. We put our IV pumps outside with extension tubing. We, you know, like we learn these little tricks from everybody downstate. And so as we were standing here kind of weeping for all of you thinking, do I go and offer my services down there and help? But what's going to come up here? I can't leave my own community to suffer if I leave and then I get quarantined and can't come to work. So there was this struggle of like this grief of almost survivor guilt for you, where we wanted to run and help, but we knew we needed to stay and prepare. And that was really scary.
Yeah.
Thank you, Julie. Christopher, you worked in the ED at this time during this pandemic. What kind of reflections or lessons learned that you can share with us?
Well, for me, the transition from just like a normal work day to a new normal with the pandemic was rapid. So we got like memos about it, and I was like, all right, it's going to be just hopefully like Ebola. But no, it suddenly became like a new normal. And I was like, whoa. So for me, I work only on the weekends. Well, Friday, Saturday, Sunday, that way in order to accommodate for school. So 1 week, it's just a normal ED, the drunks, the stabbings, the shootings, sure. Then next week I come in, suddenly we transitioned from just that to having an isolation room where we would rule people out, to suddenly it's a whole isolation unit, and there's just new construction going on, and it was just a lot to take in. First we were overwhelmed, and there were a lot of new policies being put in place. That it was just a lot of rapid learning we had to do. But overall, I believe a lot of folks saw that New York Times article about Elmhurst. So there was that. But we're here now.
We are, and we have survived. All of us, all of you, and your staff have survived, which is such a testament to all of, I think, nursing in general, which has always been our stamina, and how, you know what, we just don't, when things happen, we just do things. We roll with it because we have to. And so even if it's not written anywhere, we kind of sometimes make it up as we go along, but obviously based on evidence and based on our experiences and knowledge, to make the right decisions at that time. And so I'm going to call Emily. What about your kind of reflection?
I'd say my biggest reflection is just the mantra, teamwork makes the dream work. From the working with your colleagues in nursing and the providers, the residents, the attendings, even right down to facilities who are coming around every 10 hours or something to check to make sure our negative airflow rooms were not just at regulations, but exceeded them, to make sure that we were safe, because we were kind of MacGyvering our situation for a while. But really, the aides, as Julie was saying, we had transitioned and made part of the special care unit into an intensive care, where we were taking care of ventilated patients in rooms that, being in the ICU, were not set up how we were accustomed to. And big windows, and learning how to write backwards because we couldn't be heard through all of the PPE. But everybody just pulling together, because you can't prone somebody by yourself. If you're in a room and you run out of supplies, you can't just pop out and get it and come back. Somebody's got to be there. So that's my biggest takeaway, kind of reflecting what Kyle had said about everybody rallying together to get the job done and to provide the best patient care that we could.
Thanks, Emily. So far, all of you have worked in an acute care setting, but I think COVID really even went beyond that. So Whitney, I know you work in an outpatient setting, which again has a different twist on all of this. So if you could share your reflections on this.
Yeah, so in the outpatient setting, we didn't have the acuteness that you guys all experienced in the hospital, but we had to figure out how we were going to actually provide continuity care to our patients because we were not bringing them into the office. And we have chronic patients who need, frequent evaluation for their neurological conditions. And it was trying to figure out how we were going to make sure everyone was safe as far as like from COVID, but also making sure we were providing care for our patients. So we figured out how to do telemedicine, and thankfully, with SUNY Delhi's help, like I know how to do Zoom and all the telemedicine stuff, just tele stuff that we've done for school. It just made it easy. And then part of my job was just to train staff on how to be able to do this. And one of the most difficult things we experienced was trying to teach patients how to do telemedicine appointments over the phone. So we all, practice, and some of our patients, unfortunately, were not able to do video conferencing. And so our providers had to end up calling them on the phone to provide some type of care. We've now started to bring our patients in to the office. It's kind of about 50-50 are still telemed. And then we have facility patients who, because they're at such a high risk for COVID, there's all these other procedures that we have to put in place for any patients that reside in a nursing home or group home facility, such as we automatically have to put on PPE for all those visits. But we did, every ambulatory registered nurse had to go inpatient to get trained in case, a big surge had come. But thankfully, we didn't experience that. But the one silver lining for outpatient is that hopefully telemedicine will continue because it's not perfect and it shouldn't be replaced in office visits, but there is a time and place for telemedicine appointments.
Absolutely, Whitney. And I'm just going to go off script here for a minute because as I heard all of your reflections, I'm just wondering, has this has this changed nursing forever? Has this pandemic changed how we do nursing, how we do healthcare? Will we ever go back? I hate to use the word normal, but will this be a change that will be long lasting, I guess, as you see it? And if you could, in what ways could that be long lasting? Because I'm looking as an educator, like how do we may need to change the way we educate our students across everything. So what's your takeaway on that?
Susan, this is Julie, everybody, for anybody who can't see me on the line. What I think, so I actually did a press release today for Vocera, right? And we talked a little bit about, like Emily was saying, trying to write backwards on the glass. And when you're in a PAPRA hood and you have a Vocera on, if it's lower on your chest, the fan. And so we talked about what does this look like forever, right? So I think we have, well, one thing we always knew is that nurses are very adaptable. We do learn on the fly. We figure it out, right? And so those protocols and processes that we created back in March are kind of normal now, right? So we still have COVID in the hospital, we still see it in the clinics, but nobody really panics anymore. This is more common, and this is like, okay, so we know how to care for these patients. We know how to transport them through the hospital. We know what kind of the trajectory of illness sort of looks like for this population. And it's not going away. So we've just kind of adapted. And I think that is kind of where healthcare is going to sit for nursing.
Yeah, I agree with that. I think for me, some things will change. And I think it has to do with the ability to adapt and the ability to take on different roles. And I think that's something we have to kind of teach the new generation of nurses, is to, really have some diversify your skill set. And be able to, adapt quickly when there is change, because it could happen. It did happen here. We've had some close calls in the past that fortunately didn't pan out, where we had to change drastically. But that to me was the biggest reminder. Some things that they've been beating into my head from first day of nursing school, that you heard a lot of that I think we really need to get back in touch with are, again, health promotion and maintenance and disease prevention. And I think this is really knowing our diseases and knowing more than the public. I think we owe it to our patients and everyone to be able to chime in and correct people when they're wrong about things in a nice way, of course, but like, if they're coming out with false information, we have to be able to step up with confidence and say, that's absolutely not true. This vaccine is safe. Or, you know, when it comes to the flu vaccine, for example, there's a lot of people who still won't get that, even in the situation we're in right now. Or the HPV vaccine or the zoster vaccine. There's so many vaccines we have available that people won't take because they've heard something, you know, they heard a rumor from someone or they heard one person had a bad experience. So I think it's getting back in touch with some of the basic stuff we already know as well that we've been taught.
Yeah, I think, you know, maybe we finally have a voice that will be listened to. I think we need to be louder. So thank you. Anybody else? Okay, so I'm gonna go to I'll go back on script now. But the next question are really just kind of to find out. I mean, you know, Kyle, you actually had COVID and were working from home, and everybody else is, you know, dealing with whether it's management or, you know, staff nurses but like, how did you cope? What did you use? What were your coping mechanisms to feel safe or good during that time? Because it was scary in the beginning, you know. But what kind of things did you do for your own personal self-care during that time?
So for me, personally, what we're doing right now, connecting with family through Zoom while I was sick was a huge deal. You know, that was really helpful. But then it got to a point, I mean, we literally had, not to sound crazy, but we had an ambulance going by my building right where I'm sitting right now about every 10 minutes. I mean, it really was scary. And it got to the point down the road where I was feeling like I was having maybe even panic attacks. So we actually had a partnership with the psych department at our hospital. They reached out to all of us and all of our different teams and were available at any time for free counseling. And I took advantage of that a few times, not afraid to admit it, and just talk to him and about what I was feeling and how scary things were, because you just don't know when it's happening. It's kind of like 9/11. At the time when that happened, you didn't know if there was going to be more, if that was it, like what was going on. You know, it reminded me of that because there was so much uncertainty. So that's when I felt like I would utilize them. And as far as staff, the same thing. We have a healthy mind thing that also links you to psych and some other coping strategies that they had available to the employees. And, you know, especially what I worried about with my staff was just they saw a lot of, at the time, of death in the early, you know, surge. And so I had to actually at one point call psych in to do not an intervention, but to be at the whim on the floor because we were actually running a COVID hospice floor. And we had, I think, 3 deaths in a matter of one shift. And I said, I need someone up there. We need support. Like, this is not normal. You know, this is not the normal. And so they were on it. They were all over it. And I think everyone appreciated that partnership there. So.
Yeah, and I hope that if we learn lessons that as nurses, we need support too, not only in COVID, but in other times. But I think as nurses, we're always the helpers. You know, we're always there for everybody. And I think it can be, sometimes I think it's very easy for us to forget about ourselves. So I'm very glad to hear that, Kyle, and I do hope that kind of continues under, going back to that awful word, but that normal situation. But anybody else have anything to share about coping mechanisms, whether it's through your association or just through what you did personally? Emily.
I can tell you a couple of things that I did in addition to, you know, reaching out with family. And in the early stages, we, you know, were getting what type of PPE do we need to use? And you saw, nurses in Italy, they're in full hazmat garb and, they're like face shield, mask, gown. It's like, oh, geez, I feel like I need more. I'm seeing people around the world are just covered head to toe. And it became very clear when you went online to try to buy like scrub caps or anything that they were gone. They did not exist. And one of the things I did, I actually started making them, like sewing them, and I made about 50 of them, and I just gave them out to coworkers. I just said, hey, if you want to cover your head, have a scrub cap. I don't want anything for it. It's just a way for us to protect each other. So that
By the way, they're beautiful.
Thank you. But just, something to, because when I went home, you're thinking about it. You're thinking about your coworkers still at the hospital. You're thinking about the patients that you were just with for 12, maybe sometimes 13 hours, sometimes 14. And it was a way to kind of redirect the thinking that was already going to be on COVID, but here's a way that I can help to protect my coworkers. The American Association for Critical Care Nurses, they put out an article, I can't remember if it was June or July, I was trying to look it up real quick, about identifying, what it is you're feeling. Are you feeling compassion fatigue? Are you feeling moral injury or insult? Are you feeling burned out? And then just how to, different ways in which you can cope. I went into music. I play guitar. I'm learning how to play piano. So I use those a lot. And then one of the things that also helped me feel safe, I made a COVID bag. So when I go to work, I bring my COVID bag. And in my COVID bag, I have face wipes. I have a complete change of clothes. I have a container for my shoes. So when I leave the unit, before I even step off the 5th floor of Bassett, I am completely clean. I'm not taking anything home. Everything went right into a container, ziplocked. So when I came home, gloved up, put it right in the wash, and it made me feel better. One of the other things that in Cooperstown that we did that was really a very nice gesture and another way that people could feel safe was we have a sports center that had closed. And they had said, they had offered, hey, anybody who wants to shower before they go home, they were welcome to come and shower and change before they got home. And so that was really nice to know that that was an option, because a lot of people were fearful about what they could be bringing home to family members. So that was a really nice way to see the community supporting us, because you'd hear about, like in New York City, the 7 o'clock cheer out the windows, and that's great. We don't exactly have that. I mean, we do to an extent, but to know that, hey, the community members, how can we help? We had restaurants bring us food. We had our first responders from, I don't know, Julie, I don't know how many counties were there.
There were 7 counties with their ambulances all doing siren cheers that you had to change a shift. And
yeah, that was pretty awesome to see. And just in terms of supporting me, my church family did a drive-by during Nurses Week in support of me, and that was really helpful. That really meant a lot, that even at a distance, people were still there for you. So that was for me.
Those are all great things.
Yeah.
Christopher or Whitney, anything that you could share about your coping, or how you cope during that thing? Is there anything that, Christopher, how do you, after your 3-day, 12-hour plus shifts, how did you cope? Or, can you hear me? No, I can't.
Oh, hello.
Yeah. Yep.
Oh, fantastic. So first, whenever I'm going over to work, like that transition felt overwhelmed. Like since I was the charge nurse, like I just normally help with like tasks throughout the ER, drawing blood, EKGs, that sort of thing. But when COVID hit, just the sheer volume of patients coming at you was overwhelming. I just felt like bread out of the oven that's just being torn apart, but obviously less delicious. I had, again, friends and family. Like, oh, my family was such a great support. We were short on PPE, and I was able to acquire a face shield from my dad. So that helped out. I was able to just keep reusing that along with a respirator. But again, not being able to physically be near them is tough. But I guess it's better because again, in Elmhurst, it was like one of the that epicenter. Actually, around in April, right around that time, I was celebrating my birthday, and my wife and I we ordered some food since it's right by, and I was wondering, did they change the recipe because this is really bland? And I'm like, oh nope. A few days later, I got swabbed, got COVID. Happy birthday. Yeah,
Yeah.
but again, I got over it. Unlike was it one of our coworkers? He got sick and he didn't make it, but that brought up for coping. We have this thing called Helping Healers Heal. It's for healthcare workers, developed by one of the doctors here, and it's for debriefing and talk about provider trauma. So in this particular sense, we spoke about our coworker Erwin, who passed away, and we could just unload anything in addition to just talking to friends and family. So that was what we did for our debrief.
Those are tough. It's tough to lose our patients, but when we start to lose colleagues, that hits home, definitely. So I'm glad to hear that there was a support system that was put in place for everyone. Whitney, any coping mechanisms you used?
So for my personal, just, trying to stay in touch with family and friends. As the weather got nicer, I was able to go visit friends, and we were, social distance, but it was at least nice to see their faces, even if it was 6 feet apart. But in our environment, work environment, we ended up losing a lot of, not with death, but like they ended up leaving to go find other jobs because, especially the secretarial staff, because there was a lot of pressure being put on them to schedule these telemedicine appointments, and just they were burnt out, and so they so it ended up causing even more kind of stress across the board because we just were so short staffed, and so we offered our staff, just like similar to everyone else was saying, Upstate offers employee guidance and counseling, but we're still trying to recuperate from a lot of our staff leaving, because getting new staff during this time has also been its own issue. But just trying to stay positive, and trying to get staff to see that there will be an end.
Yeah. I mean, I think all of us, if we didn't before, we certainly appreciate our family and friends, probably even more now through the distance. It means a lot. And I think that will probably continue for a long time. And that's the silver lining of it. I always say, I have to think of something positive here that comes out of this. And I think that's a huge positive experience that we're all feeling. And in that light, I'd like to ask is, if you could say, what was one positive experience that you come away from in this? Because we know how awful it was during this time, but what was one of the positive things that you will take away from this experience, whether it's in your personal life or in your work life?
So for me, I would say, I think we're always capable of more than we think. I know that was the case for me. My initial reaction was, what am I going to do? I don't know what to do. Oh my God. Like you said, there's nothing written. There's no book I can follow. So it was like, but then it just happened. We got through it. So it was that. And then I think, speaking to kind of what you ended with, really enjoying life and not taking anything for granted. I don't think I ever really did, but so much more. Everything to me is so much more special after living through that. And really, hopefully, we were looking at possibly another surge now, but hopefully when this, we can look back and say, okay, like this happened, we got through it, we're stronger now. And really, when we have those opportunities to do stuff, really take advantage of it and don't take anything for granted. So I think those were the small little nuggets that I got out of this experience.
Thanks. Julie?
You know, I have so many positives. You know, this is horrible. This is absolutely horrible, but the good and just, it is so inspirational to see that people were so willing. I'm talking staff, I'm talking neighbors, I'm talking support staff. Everybody felt this impulsive need to help, much like 9/11, right? So what can I do to help you? And I think the trajectory was so fast, right? So I had to pick, I have two college kids, they're on opposite ends of, you know, one's in Massachusetts, one's in Western New York. I picked both of them up on one day, and then we had our first 5 cases the next day, and I didn't come home for the next 4 weeks, 5 weeks once. And so you panic a little bit about your family, you panic about your neighbors. When I did sleep, all I had was these visions of all my nurses dying because we didn't have enough PPE, because we didn't know. And every day you came in, people were like, what can I do? I'm here, we're good. No, I don't need anything. No, I don't need a bathroom break. No, I don't need to take my PAPR off. I can do another shift. The camaraderie and the willingness to say, as a profession, we've got this, is something that was so beautiful that I don't know I will ever forget it, ever.
Thanks, Julie. Whitney?
So Julie had kind of touched base on this in her department, but we have now, everyone knows how to cross cover, especially the nurses can do everyone's job. And that has been something we've been striving for so long, but there was no alternative. So everyone was kind of forced to learn everyone else's job. And so we're a much stronger department now because of this. Shoot, there's another thing I was going to say, but I forgot. That's okay. But that was, oh, and the telemed, just that. Hopefully that will be our future.
Thanks.
That'll be really important for our patients.
And I agree with that. Thank you. And, you know, we're closing in on 4:40 now. And I do want to have one more question that I'd like to get everybody's opinion on or reflection on is, you know, what advice would you give to a new nurse or a nurse or a nursing student in a program, or somebody who's looking to go into nursing? What kind of words of wisdom would you give? What do they need? What should they look for in their programs?
So that's a tricky one in the current situation, right? Go into nursing, you know, you didn't see what just happened last 6 months.
Yes.
So I think like what Julie had mentioned, the things that we saw and I think, again, taking some of the positives out of there, and that's something I did leave out, seeing how we pulled together and really, again, rallied together, and how people really stepped up. People that used to work in the ICU were back in the ICU. You know, we boot camp trained all the nurses. Like, we looked out for each other, and I think that speaks to our profession. We stick together. We look out for each other, and but again, it's still, my opinion hasn't changed of the profession, probably because of those things. But also, it is, again, to go into whatever field you go into and go into nursing, knowing that these kind of things can happen and be real about it. But the way to protect yourself is to know the science, study up on it, and also in addition to that, knowing what we're dealing with, is to really diversify your skill set. Try not to box yourself into one thing. Like, I'm just going to go do maternal child, or I'm just going to go do something. You know, I think the key is to having a diverse skill set. And I think that will prepare you for these kind of situations. And even if you don't, though, be open to it. You know, be open to the idea that, okay, this is my specialty. This is what I'm used to, but this is not normal. And I need to kind of, you know, grin and bear it until we get through it. And then you'll hopefully get back to what you were hoping to do in your career. But, you know.
Yeah, I think early on, I was always told that there's no I in team. And that continues today more than ever. You know, we're just not, we do need each other to do this. Emily, any thoughts?
Can you hear me? Okay. I would say probably in terms of, you know, in nursing school, because again, I was just there just a couple of years ago, and nursing was a second career for me. So I would be looking for some place or a situation that gives you the foundation, because being flexible, kind of what Kyle was saying, is if you've never done anything else other than one thing, you don't have a great foundation. So when you have a foundation, you can build in terms of going into a specialty, but then you still have that core set of knowledge and skills that even just being, not too far out of school, I'm being looked at now as somebody, as a resource. And, somebody will say, well, how'd you even think of doing, X, Y, or Z? I was like, oh, well, we had this patient on medicine that we did something with. And again, that's, my very beginning. That, I still go back to, like going back to the foundations, going back to the basics, and just looking for a place in which you can really have that education, have that support, never be afraid to ask a question or ask for help. Because again, this is a team, you're never going to be able to do this on your own. And be open to the learning opportunities. Some people, they get scared. They get really nervous, and so then they don't want to try. And you need to.
Yeah.
You need to try, and you need to put yourself out there and say, hey, I want to try this. Will you be my backup? And at least, from everybody's stories and from my team that I work very closely with, I have never been told once anywhere along the line, no, figure it out for yourself. That's never been the situation. And but just be willing to ask for that help and receive it. That's kind of hard to do, is to receive help too.
Yeah. Whoops. I mean, I might put you on the spot here a bit, but is there anything in your nursing Delhi education that you wish you had, that you didn't get to prepare you, whether it was for the pandemic or just nursing in general? Or anybody can jump in. Because you're all graduates, I just wondered if, is there something more that your education could have helped you? Or do you feel it was pretty solid and sometimes things just come with experience? I don't know.
I think it was pretty solid. I do remember being in lab one time, and Mrs. Ackerley, I can't remember what we were doing, but she hit the simulator, and Mickey Hart just started screaming, and you're just like, what is going on? Patients will do that. It's like, well, I didn't touch you. What's going on? And so that was, just kind of that curveball was there, and not expecting it, or
planning for the uncertainty. Yeah, sometimes planning for the uncertainty. Yeah.
And I think, so coming from an administrative point of view, where I see students from Delhi, I try to introduce myself as they're here, but the variety of applicants that I get from the local schools, I will choose a SUNY Delhi graduate over some of our other local schools because they are prepared to start at the bedside. They have the skill set to jump into the workforce, because even a 2-year ADN program, there is so much that is missed in a 2-year program. There's no way you can pack it in. So that's that first year into practice, that transition into practice is really like a 3rd year of nursing school. And the Delhi students that I see that we hire are so much better prepared at the bedside than many of our other local schools, that I am happy when somebody says, I went to SUNY Delhi, I'm like, you're hired.
That's great to hear. Thank you so much, Julie. You know, we try, and I think we try to do as much of assessment and evaluation of our program, because I think it is important for us to make sure that they are workforce ready. They're not going to have every single thing, like you said, in a 2-year program, it is just jam-packed. But I think workforce ready is really where you want to be a safe practitioner. And that's, you know, one of the things we always, you know, prioritize is that safety factor. Any other parting? I want to leave time for questions and answers, but I also want to just have one last, if anybody has one last thing to say from the panelists.
Yeah, I think from my standpoint, you know, Delhi definitely, just to touch on that part, you know, definitely prepared us. And I think just that baseline entry to practice, it really did a good job, you know, and attention to detail when it came to the basic stuff, med pass, all those kind of things I still remember to this day. You know, really there was no kind of, I didn't ever feel like there was people kind of getting brushed through the program. And I also see students from other schools and you're like, you know, you're like, whoa, they let you graduate, you know what I mean? And I never felt that way at Delhi, where we just kind of brush people through to get them through and just like get them their certificate. I never felt that way. And I think it does show, you know, at that entry level, and you can't teach them everything, but it definitely prepared you as best you can. Given the circumstances now, you guys will probably add a little more on isolation precautions and stuff, I'm sure, but otherwise.
It definitely changes some of the scope of things, yes.
Yeah.
I would think, I think one other thing that I've kind of just taken away from just the COVID pandemic is, and even we talk about it in school about, you know, you're not just taking care of a patient, but you're taking care of the patient's family as well. That was something that I've been doing, but it's really different with COVID, and because we had no visitors, even when people were doing very, very, very poorly, and their loved ones couldn't come in and be by their side as they passed away. And I took care of the last patient in our COVID unit, and it was just him and me, and that was in Zoom. And I was with him for 12 hours. The family had decided to withdraw care the following morning. And at that point, we weren't doing a lot for the patient other than keeping him comfortable. But the care that I gave the family, I guess I didn't know how much it had been, how much it meant to them, being that, you know, they couldn't hold their loved one's hand, but even through a PAPR and a gown and gloves, I was there to hold his hand. And that was, you know, that's something that, you know, will stay with me forever.
Thank you. Okay, so we have about 9 minutes left. We just really have one question at this point in the Q&A, and that is, and I think some of you already kind of touched upon this, but what are some of your biggest pieces of advice for nursing students who are both in school and maybe already out in the workforce? Is there some big, if you have one thing for advice for students who are in nursing school or just starting in the workforce, what would that be?
Keep your books. Don't give them away. Don't sell them. They are your resource. You'll continue to use them. Do not get rid of them. You invested in them. Keep them.
I would say network. I think keeping in touch with some of your peers when you all scatter and find your first jobs, I think that transition into practice is very difficult. That first year is scary. I can't tell you, I would drive home and call the unit 4 times as a new nurse saying, I forgot to tell you this, I forgot to tell you this. And they'd be like, Julie, it's a 24/7, I got it. And, having that camaraderie about what it's like that first year, once you get out of school, it's really important to talk through with your peers, just to know that it's normal and it's okay to feel what you're feeling.
I think Kyle kind of touched upon this, but just that find an area that you like, but don't necessarily commit to it, and look at other areas that you might be interested in. Don't get like pigeonholed into one area, and build that foundation.
Yeah, I think that really is one of the takeaways I had, was just, diversify your skill sets. Don't, pigeonhole yourself into one area. Keep your, options open and try different things. I think Julie may have mentioned it, is there's some people that try to spend a lot of time trying to find a way not to do something, a way around. So just, the people that embraced it, like especially in the example of the pandemic, the people were like, sign me up, let's do this. I felt like they handled it better and did better than the people that were kind of like, and I don't judge anyone, but I felt like the people that really hit it head on and said, this is the problem, it's not going anywhere. How can we help? What can we do? There was no judgment happening. It was a very judgment-free zone at the time. Everyone was happy to have the help. And that was the feedback I got, whether, we had people going to Queens, we had people going uptown, Manhattan, Brooklyn, every borough except Staten Island, we had people going from our hospital in Manhattan. And, that was the feedback from everybody, was they were just happy to have help. And if you didn't know something, they'd get you through it, and that's really what I've experienced, not just during the pandemic, is if they see that you've got the motivation and you want to learn it and you're willing to learn, people will spend the time and take the time to show you.
Absolutely. Thanks, Kyle. Christopher, I'm going to give you the last word here. Any advice that you could give to a student in nursing school or somebody who's just venturing out their nursing career? What's the big advice you would give?
Oh, can you hear me? Hello?
Yeah,
Yes?
we can hear you.
Oh,
Yep.
fantastic. Well, I just had to say what my professors told me when I graduated. Just seek for like a long orientation program with your hospital facility. So the reason that being, you want to be acquainted with your environment and the people you're going to be working with, and also the equipment. Oh, that was a big thing during COVID. That way you get a sense of the flow of the unit. That way, by the time your orientation's finished, you're comfortable, and it becomes second nature, because when you're overwhelmed, you're just going to fall back on that training and you won't be a deer in the headlights. So that'd be my big thing. You'll know it, you've seen it, now time to go and do it.
Yeah, and I think, for anybody new, whether they're in school or just starting out, I think, Kyle, what you said is be that sponge. Show people that you want to learn and you want to participate, and you want to explore your horizons, and people will come to you and help you do that. Because my nursing career, if you told me in the beginning what I was going to end up doing, I would have said never. But I always was open to opportunities, and saw what could I do and how can I do this, and let's try it. So I think that's a great takeaway about just being open, because there are so many possibilities in this nursing career. So explore. Anything else from the panelists?
I've never been more proud to be a nurse. It's a great profession. Come join us.
Thank you. Yes, I agree. I agree. So I think that is all the Q&As we have. And right now, I'm going to turn it back to Lucinda. Thank you.
Thank you. Just want to say again on behalf of the SUNY Delhi Alumni Association, thank you so much to Susan, Deane, and especially to our alumni panelists who I know are very, very busy. Thank you so much, Julie Hall and Whitney Hyde, Emily Mattison-Welsh, Kevin Merandy, and Christopher Samson. It was lovely having you join us this afternoon with your heartfelt words and advice for everyone. We hope you all stay well, and we hope that everyone will check us out again for other alumni webinars we have planned. And we're planning to do a virtual reunion and homecoming in October on the 23rd and 24th. We want to stay in touch with you, and we hope you'll stay in touch with us. Please be well, everyone. Thank you so much.